Hello, and welcome to Case Study 1 by Camille Dang, Maddie Gostin, Maria Alejandra Perez, Edelyn Samways, Jamie Sands, Chrissy Thelman, and Hannah Weinert. I'm Jamie Sands, and I'll be taking you through our presentation today on the first case study. Our scenario. The night charge nurse and the day charge nurse are discussing patient priorities for the next shift. The night charge nurse indicates that most of the night staff prefer a detailed checklist of tasks to be completed during the 12-hour shift. The day charge nurse replies that there are too many unexpected events that can happen during any shift to rely only on a checklist. However, both charge nurses agree that patient outcomes are the priority for the nursing unit. And this is a very good priority to have. On into our introduction of how we viewed this situation. Decision making is no easy task, and in the case of this scenario, the focus becomes increasingly challenging as the task turns to the importance of delegation and responsibility as a patient advocate. It is evident that there is a slight discrepancy in the way both the night and daytime charge nurses would like to alleviate the issue of whether to use a checklist or continue as they have been. A key feature is that they agreed that the patient's care is priority. In order to keep the patient at the center of this decision, it is important to incorporate tools that can aid in this decision. Additionally, the charge nurse serves as a leader, supervisor, mentor, and educator among their coworkers and patients. As a leader and manager, a checklist may or may not appear to be the best solution to the issues that the units are facing. In this position, it is important to gather the available information, evaluate the pros and cons, and incorporate the overall thoughts and feelings of the unit in order to make the best choice. Although this is delegated by the charge nurses, it is important to include the nurses on the unit. And we will see how the charge nurses handle the situation. Here we see the duties of a charge nurse. They are a leader, manager, role model, mentor, educator, supervisor, and as you can see, the list goes on. Charge nurses have many duties and responsibilities and have a lot of weight to their role. And on the side, you also can see the daytime nurse versus the nighttime nurse and the differences in what they encounter. You might see upon first glance that the day shift nurse has quite a long list. Both are long, but the day shift has a few more variables to consider, which would incorporate the concepts discussed in the views of the charge nurses. So let's take a look at question 1. Explain the perspective of each charge nurse based on the concepts of leading, managing, and following. At the night charge nurse perspective. So, this scenario identifies the night shift and the day shift as subcultures within the same unit. The night charge nurse serves as role model, mentor, and educator in their unit. They must take on roles as both a leader and a manager while incorporating their unit as a team into decisions rather than treating them as just followers. The night shift nurse is displaying some very important leadership skills by listening to her staff's request of having a checklist. Listening is an important nursing skill. The feedback they have received from the staff directs them to help improve the unit. By translating the staff feedback into an actionable plan, they demonstrate leadership skills that shows that they value the staff's input. In their perspective, checklists are highly reliable tools. A checklist may provide the structure and consistent care throughout the unit. A checklist may also provide reminders and precision in care, increasing control, which is a main component of management. Checklists may also increase efficiency and order in a unit, which is, again, a managerial factor. There has been much research conducted on the power of checklists, especially in the context of patient safety. Improvement in patient safety has been found when a checklist is followed completely, but not when the checklist has only been partially completed. This means that some of the patient safety comes down to the responsibility of the followers. The night charge nurse, therefore, must know that her staff will follow the checklist, showing trust in their competence. This trust furthers the cohesiveness of the unit and improves patient safety. Answering question 1 now, from the day charge nurse perspective, the provided patient care and activity level on the unit differs between the day shift and night shift. Although the day shift and night shift likely see the same patients, the culture varies greatly. These factors contribute to the difference in opinion and about the use of a checklist. A study conducted by Hallman describe checklists as cookbook medicine that don't allow healthcare providers to individualize the care of their patients, while also adding time and stress to an already busy workday, which we saw earlier in the presentation of the lengthy list of activities that daytime nurses encounter. Additionally, they found that there were many inconsistencies in the use of the checklist, ultimately defeating the purpose of its use. Because the hospital is fully staffed during the day and therefore very busy, there are often unexpected events that happen during the shift that do not necessarily happen during the night shift. The day charge nurse may feel that through implementation of a checklist, she is decreasing the autonomy and flexibility of her staff. Because of this, they would be managing their staff more so than leading them, especially if their opinions were not taken into account. In order to determine the best course of action, the day shift charge nurse should communicate with her staff about their opinions surrounding the use of a checklist. Because the day shift scene changes rapidly as well, it's important for the charge nurse to implement a tool that not only maximizes patient safety, but also supports the autonomy of the staff. By incorporating the staff into this decision, they create an atmosphere open to communication while still demonstrating skills of a leader and a manager. Finally, a collaborative atmosphere encourages her staff to not only follow the lead, but also be self-managers when delivering patient care. Next, we're going to look at question 2, which asks, how might each charge nurse further explain their position to the chief nursing officer? So let's take a look at how these different leaders would points. So the night charge nurse explanation. When going into a negotiation, it's imperative that the main goal or purpose is at the center and serves as a framework for the discussion. In this scenario, the main goal is to improve patient outcomes, and that is consistent throughout. By keeping this objective cohesive among the two parties, a case for each side can be presented. The night charge nurse, needs to be prepared before meeting to negotiate the possibility of introducing a checklist to improve patient care. The night charge nurse needs to understand how much they are willing to compromise before going in. Having prepared possible trade-offs, multiple alternatives, and established a clear bottom line to ensure that the night nurse can effectively make the changes that they wish to see. For example, the night charge nurse can ask if the checklist can be something that only the night nurses use, and they find the checklist beneficial to providing the best patient care. In addition, the night charge nurse is representing the night nurses on their collective request. Checklists can be useful tools to improve communication with the whole healthcare team. One study found that after 6 weeks of implementation, the percentage of physicians and nurses who understood the patient's daily goal increased. This is a great finding. To be a good leader and manager, the night nurse will use their position to emphasize the vision the night nurse desires and to help improve upon the unit's collective goal. Day charge nurse would view this same situation. And the daytime nurses and charge nurse have an overwhelming amount of work providing the best and safest care to their patients. In addition to the numerous admissions and discharges of clients throughout the day, these nurses also must complete the proper documentation for the care that they provide and be diligent in avoiding any medical errors or poor assessments or interventions because they are very busy. The request made by the night charge nurse to have a checklist filled out by the day nurses may be viewed as an unreasonable thing to ask. This would require more paperwork from the nurses, which means more valuable time away from the patient. This could cause medical errors to be made and could potentially be harmful for patient safety if the nurses are too busy and unable to better attend to their patients' medical needs. According to a research study on how nurses and their work environment affect patient experiences of the quality of care, nurses feel pressured to increase productivity and report high administrative workload. They stated that these factors will not improve patient experiences of the quality of nursing care. The purpose of quality care is to be available at all times to give the proper care and avoid mistakes from happening. If the shift reports were enough to give all of the necessary information at handoff, why is this extra document needed? Requiring extra documents may only be more unnecessary burden and valuable time away from the patient. However, the day charge nurse and staff nurses may be willing to compromise or discuss more ideas as far as how both shift teams can collaborate on a solution. It is imperative that patient safety and care remain a priority, as well as being supportive of the nurses. The priority is patient safety and to support the daytime nurses so that they can be equipped to give patients the exceptional care that they deserve. Nurses' perspectives, we're going to take a look at the conclusion to this unfolding case study. So as we've seen, there are many leadership roles within a nursing unit, making it difficult to satisfy everyone's needs. As a leader, one works to maintain harmony and promote teamwork within the staff of the unit. The charge nurses do this by identifying their team's needs and advocating for them, which we saw with both charge nurses. The night charge nurse advocates for her nursing staff to receive a checklist from the day shift, as they believe this will improve productivity and organization. She believes this is a viable option as research has shown that checklists do increase efficacy and improve patient safety when they are followed and completed. The day charge nurse is most concerned that creating and following checklists is not a sensible option for their team, as their shift is more unpredictable than the night shift, and it may not benefit their situation. Additionally, this may take away from the nurse's time with the patients to make a checklist for each patient and do additional paperwork. This may further lead to more adverse outcomes for the day shift nurses than it would benefit for the night shift nurses. They believe the current patient handoff method works successfully as is, not needing any changes. Her greatest concerns are maintaining autonomy within each of their staff members, while also finding a way to support the night shift nurses in a way that best supports the unit and the patients, as we've seen that patient-centered care throughout. We have learned collaboration is key. As this case study was dissected further, it solidified the foundational skills necessary for institutions to run smoothly. That is, communication and collaboration. As mentioned, a collaborative atmosphere will bring the nursing staff, both day and night, together to better support their reasoning for their opinions about the checklists. Ultimately, despite the differences in opinion, weighing pros and cons through evidence-based literature and the willingness to listen openly to the different teams will be the key in finding the solution to whether or not they should use checklists. No matter the disagreements on the use of checklists, these nurses hold integrity to their unit while aiming to achieve the common goal of excellent patient outcomes, which is truly at the heart of nursing. And here, I hope you enjoyed our unraveling case study of to checklist or not to checklist. Thank you.